Hello everybody, my name is Jeff McCoy, and I chose to do my informative speech on insomnia. Insomnia is the most common medically diagnosed sleep disorder. Insomnia is characterized by the inability to fall and or stay asleep. There are many negative effects of insomnia that do affect one's ability to function throughout even the most normal of days. Insomnia affects people of all ages, race, and sex. Fortunately, there are many treatments that have successfully treated acute and chronic insomnia. So if you are suffering from this very common sleep disorder, there may be a solution out there for you. Insomnia is a medically diagnosed sleep disorder that can and often does have negative impact on life throughout the day. Many people who suffer from insomnia are not just suffering from the lack of sleep, but they are suffering from the inability to concentrate and function effectively throughout the day. According to the medical website WebMD, the amount of sleep an individual needs varies from person to person. Between 6 to 9 hours of sleep a night are generally acceptable. Less than that, or less than the recommended amount, can lead to many complications, including fatigue, the inability to concentrate, and in prolonged cases, even confusion. There are two types of insomnia, acute and chronic, both still characterized by either the inability to sleep or to stay asleep. Anyone can experience acute insomnia throughout life, and it may often be described as a restless night. If you have ever heard anyone say they've tossed and turned all night, they were experiencing acute insomnia. When several of these sleepless nights occur in a month, they consider it chronic insomnia. Insomnia can and does affect people of all ages, even children. However, it is more common in the elderly. There are two types of insomnia, primary and secondary. Primary insomnia is not associated with any other factors of illnesses, whereas secondary insomnia is associated with other things such as depression, pain, and other medical illnesses. It's believed that most the elderly suffer from insomnia because they are experiencing more of the secondary symptoms. Gratefully, there are many treatments for insomnia. Drugs are frequently used to treat acute, chronic, primary, and secondary insomnia. The first approach is usually an over-the-counter sleep aid. If over-the-counter drugs prove ineffective, your doctor may give you a prescription for one of the many drugs that enhance sleep. However, extreme caution must be used. It must be used to avoid chemical dependency. In secondary insomnia, treatment of the underlying factor would be tried first. For example, if someone is experiencing secondary insomnia related to depression, the doctor should be treating the depression first. There are also several non-drug related treatments, such as eating healthy, avoiding caffeine, exercising right, avoiding daytime sleep, and avoiding meditation. Insomnia is no laughing matter. Millions of Americans suffer from this every year. When suffering from insomnia, medical attention should be sought with the proper diet, medication, and knowledge of person from insomnia or who is ever experiencing it. Well, I hope everybody has a good night's rest. Have a good night.